If I could have your attention, please. I can't ding on a glass because I don't have one up here, but if I could get your attention. I just want to welcome you to the 7th Annual Lewis Blackman Patient Safety Champion Awards Ceremony. And thank you all for coming. I just wanted to tell you a little bit briefly, and I'll let you get back to your lunch, about the awards and about some of what we've done here. So I am Helen Haskell. I'm president of Mothers Against Medical Error, and I was Lewis Blackman's mother. Lewis was a 15-year-old boy who died from medical error following an elective procedure in a South Carolina hospital. He was one of the top students of South Carolina. He grew up in Columbia and was very active in the community. And this is just one of the things that we and the state of South Carolina have done in his memory, but it's been very rewarding for all of us. So I just wanted to introduce some of the, we have a number of previous Lewis Blackman Award winners here seated at the tables, but I want to interrupt their lunch also and ask them to stand up and be recognized for a moment before we proceed with lunch. So would all the previous award winners please stand? That's really quite a lot. They are invited to come back every year, so that should be incentive to nominate people for the award. Next, I want to introduce Brian Tusink, who is going to do our invocation for the lunch. If you would come up, Brian. Brian is head of PHTS Risk Management Services and has been with PHTS since 1992. Please join me in welcoming Brian.
Please join me in prayer. Heavenly Father, we thank you for this fine day and for the opportunity to gather, share knowledge among individuals and organizations that are all working collaboratively to transform healthcare in South Carolina. We ask that you bless our deliberations, preside over our meetings, so that we can achieve your greater purpose of protecting the most fragile among us, the sick, the neglected, the poor, and the disadvantaged. As we prepare to partake of this meal and conduct our award ceremony, we thank you for the outstanding work of so many in our community. While we bestow upon our award recipients the recognition of their peers for a job well done, we acknowledge that there are many others conducting very important work for whom the only recognition will be the satisfaction of having performed their work to the highest of their abilities. We thank you for the work, talent, support, and dedication of so many. We ask that you bless this meal, bless the hands of those who prepared it, bless the people who serve it, and bless those of us who will partake of it. Bless the food to the nourishment of our bodies, and our bodies in service to you. In your holy name, amen.
Again, welcome to the 7th Annual Symposium. I'm just curious, how many of you in the room have actually attended every symposium? I'm just trying to see who's done that. We appreciate that dedicated few that keep coming back. And welcome to those who might be in there. How many of you, this is your first year to be at the symposium? Oh, good, a lot of new faces, that's great, wonderful. I'm Dr. Rick Foster. For those who don't know me, I'm the Senior Vice President for Quality and Patient Safety with the South Carolina Hospital Association. And I'm thrilled, this is our 7th year of the symposium and this award ceremony. It's just hard to believe that, we're 7 years into our work together, and it's amazing what we're accomplishing together in the state. And I think it's especially important that we have this opportunity to recognize individuals who really stood out as far as being champions for safety and quality and for improving the patient care experience and improving health in our state. And so I'm delighted to open officially the Lewis W. Blackman Award ceremony. It gives us a wonderful opportunity to honor Lewis and inspire others to great deeds by celebrating the compassion, innovative vision, and determination of today's patient safety champions. At this time, I'd like to introduce our symposium sponsors to the stage to help me give out this year's awards. First, from the South Carolina Hospital Association, Thornton Kirby. In fact, Thornton actually got to go over for a site visit with Dr. Gawande here a little while ago, and I was told as soon as Thornton appeared at the door, I was to start. So when I saw Thornton's vision coming through the doors there, it was time to start. Mothers Against Medical Error, Helen Haskell. Health Sciences South Carolina, Dr. Chris Turley. Blue Cross Blue Shield of South Carolina, Dr. Laura Long. And PHT Services, Brian Toussaint. And I would ask you, this is a great opportunity for you to show your appreciation for the sponsors for supporting the symposium and this award ceremony. It's a good-looking group. Now, I know because I'm standing in front, you can't see most of them, but they are back there. All right. Now it's time to introduce this year's award winners. And I will tell you, I get a chance, obviously, working with the selection committee to review all of the nominations. And later on, Helen's going to talk about the student award, so I'm going to leave that for her. But we had a very, very strong list of candidates this year. And it's just great to see these nominations when they come through, and this year with the essays from the students, it's just very encouraging to me that we are moving in the right direction. All right, so with that, my pleasure, distinct pleasure, to present the winners of the 2014 Lewis W. Blackman Patient Safety Champion Awards. When I call your name, please come forward to accept your award, and you're going to get a chance to have a few minutes to speak about your work. Our first winner is for the caregiver category, so we're talking about those who are very much involved in direct patient care, and I'm very pleased for this year's award winner, Dr. Brian Kendall from Regional Medical Center in Orangeburg. Dr. Kendall is the medical director of the Hospital Services at Regional Medical Center of Orangeburg and Calhoun counties, and has done amazing work with his colleagues at the Regional Medical Center, but has also been a real state leader as well, and it's been a real joy for me to work with Brian, and I'm going to let him have a chance to say a few comments if you'd like to.
Thanks, Rick. I want to take a moment to honor Helen Haskell. Obviously, I wouldn't be holding this award if it weren't for the work that she's been doing. I too had a family member harmed by medical error, and had to wait agonizingly for a physician to come to the bedside. I know what that feels like, and I want to tell you that your decision and your fortitude to transform a mother's worst nightmare into something that benefits all South Carolinians is a true gift to us all, and I thank you. I want to thank our superlative CEO, Tom Dandridge, at the Regional Medical Center. He is just an amazing individual to work for. I'm very fortunate to have a CEO that supports our safety and quality efforts simply because it's the right thing to do. I want to say a special thank you to my two mentors at the Regional Medical Center, Indon Wetzel and Dr. Arden Weathers, who are infinitely more deserving of this award than I. And finally, I want to express my extreme gratitude to Rick Foster and his team and all the amazing work that SCHA does. Between Dr. Gawande and David Marks from Just Culture and Bob Wachter, the father of hospitalist medicine, all the amazing individuals that I've learned from, methodologies like Just Culture and high reliability. We don't have to go to DC or Boston. We have that available to us right here in South Carolina, thanks to thanks to Rick. So please join me in applauding him and his team.
I want to say that one of the things that I admire about Dr. Kendall is he's such a wonderful leader, but he's a very humble leader, and so it shows the importance, value of humility, that you can do great work and still maintain that humility. So with that, we now move on to the Healthcare Executive Award, and I'm especially pleased to announce this year's winner is Bambi Floyd. She is the Chief Nursing Officer at Williamsburg Regional Hospital, and please join me in recognizing and honoring Bambi.
First of all, thank you so much to South Carolina Hospital Association and Mothers Against Medical Errors and all the other sponsors that are here today and made this possible. I'm truly privileged to be selected as one of this year's Lewis Blackman Patient Safety Champions. South Carolina Hospital Association, an organization dedicated to quality outcomes and patient safety of our own patients that are receiving care in our state, has paved the way for hospitals like Williamsburg Regional Hospital to be able to excel in quality initiatives and change the way that we give care in our rural communities. It is because our dedicated staff, some of which are here with us today, and such a wonderful team they are, that we've been able to provide a successful HOP program for our community, dramatically improve HCAP scores, maintain a 0 infection rate for over 2 years, and actively and successfully participate in multiple statewide quality initiatives. I am so proud and honored to be here today to represent our hospital's accomplishments. Thank you so much.
I think Bambi and her colleagues at Williamsburg are a wonderful example. I think it was mentioned at our early breakfast session that Williamsburg is one of the poorest counties in the country. And the work that you're doing both to improve the quality and safety of care, side by side what you're doing through the Healthy Outcomes Plan to reach out into your community and help those that are at highest risk and of greatest need, I think it's amazing work, and a lot we could learn from what y'all are doing. Our next category is the Innovations in Research and Care Delivery Award. I think a couple years ago we decided, as we were looking at the various categories, there's a lot of innovative work being done, both in research and looking at innovative approaches, new and innovative approaches to improve the quality and safety of care. And I'm very pleased to announce this year's winner in the Innovation and Research category to Dr. Cassandra Salgado. She's an infectious disease physician, hospital epidemiologist, and an associate professor of medicine at the Medical University in South Carolina, and has done amazing work and very innovative work in finding ways to reduce hospital-acquired infections and working with others to create a safer patient environment. Dr. Salgado.
Thank you so much, Dr. Foster. I'm very honored to accept this award, and like others before me, it really wouldn't be possible without the support of those that we work with, and have two very important folks in the audience tonight, Danielle Shearer and Chris Reese. It's very important when you work at a large academic center that the administration is supportive of your efforts and transparent in their work, and they've always been very supportive of ours. But I guess what I'd say most of all is thank you to Helen Haskell. I reminded myself of the Lewis Blackman story after Dr. Foster called me about this award, and it's really remarkable how you can turn an event such as that that occurred in your life to the remarkable events that can help others. And so most of all, I'd like to thank our patients who we provide care for and who participate in our studies to help make things safer. Thanks.
Our next category is the Advocacy Award, and as we were putting this award program together, and I credit Helen again for really insisting on this, we had a category, and we've had this from the very beginning, for those who are actually not formally working within the healthcare system, but are making a real difference in their respective communities as far as improving health and health care, and sometimes serving those that are at greatest risk and greatest need. And so I'm really thrilled this year to recognize a specific group and an individual representing them. A couple years ago, we also, the selection committee decided that in some cases, while this is an individual award, it could also represent a group of individuals that are doing great work. And this year, we'd like to recognize the PISOS program, which is an amazing program in this state, reaching out to the Hispanic and Latino population, and really are role models for the rest of us. And so the PISOS Promotores of the Midlands, and receiving that award on behalf of this wonderful team is Veronica Salmoran. She'll be accepting the award, and I ask her to come up now. PISOS is a volunteer, community-based organization hosted at the Arnold School of Public Health at the University of South Carolina. And if you're not familiar with it, I'm learning now, is the promotores are basically community health workers in the Hispanic Latino community that are actually working with their communities to transform health and create a better environment for living for that population. I can assure you, all of us in the room have a lot we can learn from them. It's what we could do to really improve health at the community level. So, Veronica.
Thank you so much for this award. It goes to all PISOS team that works hard every day to have a healthy South Carolina with a healthy Latino community. We are glad to have this opportunity. Thank you so much.
Helen, I'm going to turn it over to you.
Well, our final award is our student award, and this is one, I don't know why it took us so long to come around to this, but this is only our third Lewis Blackman Student Champion Award, and we have been, it's been a very exciting sort of process. This is, in addition, most of our other nominees are actually nominated. The students apply and they write essays, and the essays have been just wonderful. We were really blown away by the quality of all the essays we got. And I think it's safe to say that insofar as whose hands it's going to be in, we don't have to worry about the future of healthcare in South Carolina because we have a really wonderful crop of young people coming along. This year's winner is Amanda Jane Hobbs. Amanda, if you could come up. And before, I just want to tell you a little bit about Amanda before I let her speak. So she, Amanda's essay was really about how she had developed an interest in healthcare quality through being misdiagnosed repeatedly as a child. And her efforts since then, she's president of the Clemson chapter of the IHI Open School. She's working on a degree in industrial engineering and is interested in human factors and quality improvement. And she's had her first publication, which is about including patients on the care team. So the award really is just for the diversity of her experience and her viewpoint and everything she's going to do. And I will let her tell you a little more about it.
All right, I think my speech is a little bit longer than others, but bear with me because I have too many people to thank. I'm so grateful to be the student award winner of the Lewis Blackman Patient Safety Champion Awards this year. Named after such an incredible young mind that we lost too early. Thank you to the sponsors of the award, South Carolina Hospital Association, PHT Services Limited, Health Sciences South Carolina, Mothers Against Medical Error, and Ms. Helen Haskell, Blue Cross Blue Shield of South Carolina, for selecting me among the amazing students in our state. My undergraduate journey wouldn't be possible without Clemson University and the Industrial Engineering Department. I would like to thank Dr. Ashley K. Childers for introducing me to the IHI Open School, a multidisciplinary organization for healthcare improvement, and the field of industrial engineering. She has been a mentor to me and the faculty advisor for the Clemson chapter of IHA Open School, where I serve as president and served last year as vice president. I thank the students who have served with me these past 2 years for the opportunities to lead beside you and learn from you as we have brought in new programming and expanded membership. To organizations that have constantly supported our chapter, thank you. To the parent organization, the Institute for Healthcare Improvement, for learning experiences, especially the 2012 Student Quality Leadership Academy in Cambridge. To the South Carolina Hospital Association, specifically Mr. Kirby and Dr. Foster, for their support. And to all others who have contributed to our chapter. This past summer, I had the opportunity to work for the North Carolina Quality Center on multi-hospital projects, including safe surgery, reducing readmissions, patient and family engagement, and the Carolinas Lean Collaborative. I'm so thankful to NCQC and NCHA and mentors there, including Laura Maynard, Dean Higgins, Sue Collier, and Jeff Spade. I would like to specifically thank professors who have guided me in research projects and the organizations that have provided these opportunities. Again, Dr. Childers, Dr. David Nyans, through these professors, I have been able to contribute to the study of wait times at Shriners Children's Hospital in Greenville and to the study of the Mission 2012 Midlands event. Through the guidance of Dr. Joy Rodriguez, I'll be presenting my first publication in June on the inclusion of patients and families on the healthcare team to make more appropriate decisions and improve continuity of care. I would like to thank God and the family and friends He has brought into my life who have been brilliant role models. Thank you specifically to my grandparents who were able to join me today, retired Naval Engineer Lieutenant Commander Richard Kruger and Mrs. Elaine Kruger, who have illustrated a life of service to others. My grandfather Gary Hobbs and Uncle Mark Hobbs, pharmacists and leaders of Hobbs Pharmacy, for my first inside knowledge of healthcare organizations and for supporting my education. My wonderful grandmothers for exemplifying selflessness. My sister, also an industrial engineer, who since day one always takes me by the hand and says, "Come on, let's go." My dad, a professor, for making me fall in love with a life of constant learning, and my mother for teaching me to care for others. I'm not sure if empathy is genetic or learned, but I am sure that it is from her. See, my mother was my patient advocate. My passion for impacting healthcare did not start in college. Actually, I like to say I was born with it. I had a congenital kidney defect, and once I started exhibiting symptoms, I spent over 5 years in the healthcare system before getting a correct diagnosis and corrective surgery in 2001. After my parents and I experienced the physical, financial, and emotional consequences of multiple misdiagnoses, I knew I wanted to transform healthcare. So lastly, as not just a healthcare improvement student and emerging professional, but as a patient, I would like to thank everyone in this room and all involved in the healthcare quality and safety movement for contributing to making the world better for patients. You inspire me. Again, thank you for this incredible honor.